lot of people know chiropractors as the back doctors, which is one of our main things. We also treat other sports injuries and knees and ankles and those other things, but obviously that back's a primary, and I just want to show you a little bit about how we treat and what we treat and maybe what's causing some of that discomfort that you might be experiencing. So I'm just showing you here just a plastic model of your spinal column. Okay, here would be where your tummy is. Here's your behind right back here. This is your right hip and your left hip. As you look from the side, these are each your vertebrae as they stack up. In between those vertebrae are these little pieces of cartilage we call discs. And as each of these vertebrae come right back here and meet in that back, this is where the joint is formed. This joint is actually the mechanical unit of your spine that allows you to bend and move and function. Statistics actually show that roughly about 97% of the time of people suffering from back discomfort is due because of this joint not working very good, which is what we treat every day. Now, another 3% of the time is due to more serious issues such as a disease process, a fracture, infection, something of that nature, but majority of the time it's that joint. And so once we have identified that, when you come in, we go through a complete evaluation. We go through what's called a consultation, where you talk to us about how long this has been going on, how it's feeling, is it sharp, is it dull pain, what's going on with that, do you have a headache? We go through all that evaluation, then we go through a complete exam. After the exam, we might feel indicated that we'll go ahead and take some x-rays if need to be. We actually check for your bone health, as well as if there's any postural changes or structural changes taking place in that spine that might be contributing to some of these issues that might be reoccurring. So once we've identified all that information, we will then go through what's called a report of findings with you. After reporting all this information to you, we'll then begin what's called a chiropractic adjustment. The chiropractic adjustment goes into just kind of, again, going through and finding those joints that are just not moving very good, because when they're not moving very good, that's where that stiffness and that pain comes from, and we identify those, and we do just light impulses on those joints, freeing those joints up and allowing them to move normal again.